This is Dr. Natalie Cordova, and I want to talk about what is referred to as the sitting is the new smoking. What does that mean? Patients have been asking me what that means, and it means that sitting can be as damaging or more damaging to your health than smoking. Does that not sound horrible? Because we all know how bad smoking is for our health, but we sit every day and we think we are healthy. So why is that? Well, I'm sitting right now, and most of my weight is being on top of my spine, right? So it's being compressed. And if I sit for a little bit at a time, not a big deal. But if I'm sitting for 4, 5, 6 hours at a time, I'm really compressing on my spine. Now this is an example of the vertebrae. I like them, aren't they cute? Of the lumbar spine. So this is from the very low back. This is the front of the spine, and this is the back. You feel those little pokey things right in the back? Now what we want are nice, big, fat, healthy discs, because that dictates how much room you have for the nerve that's trying to come out. Where do those nerves go? They go to our intestines. They go to our reproductive organs. They go to our legs. We want those to work. So we want as much fluff in those discs as possible. Now what happens is over time, if you're not moving and if you're sitting for long, long hours and your hip flexors, those ones right here that are flexing your hips, so that I'm flexing right now, they're short, they're tight, they're attaching to the front of these bones. The iliopsoas attaches to the front of the L3 vertebra right here, and it will compress and tug and pull. So if you're not stretching, if you're not standing, if you're not moving, then you're not going to be able to feed that disc. If you can't feed that disc and get blood to move into there, it starts to shrink. And look at this guy versus this guy. Not much of a difference, but it is a difference, right? It's subtle. It takes a few years to start looking a little thinner there, and you're not going to have as much room for that nerve. Now, you may not even have pain. You may just be a little tighter, a little stiffer, and you don't know any difference at all. But what happens is that doesn't stop right there. It continues on. And so your body starts to lay down calcium deposits along the ligaments that hold this bone to this bone, and those are called bone spurs, and that are very they predispose you to having damage to your spine, because you can have a lot of pain when those bone spurs go up against the nerve. So you can have a lot of bone spurs and not have any pain whatsoever, but when they get right on that nerve, it can be very very painful, and many people end up going underneath the knife because it hurts so bad. Not many people want to go under the knife for fun. So that's why it gets so damaging and debilitating, as well as all the negative health effects that you've had along the way, because you're not able to have a full mobility of your spine. So it's stiffening and it's rigid, and then it gets to the point where it's just gone, right? So that disc in between, that the blood that's been trying to feed that disc for a long time is just shut off, cut off, and is not going to get in there. Because what happens when you've been sitting for so long, for years and years, not moving, not demanding blood to flow into here, the scar tissue will wrap around there. And scar tissue, what happens is that's a cheaper, easier, stronger adhesion that forms along all these ligaments, and then it doesn't allow the blood to get in there and nourish that disc. And so that's why we end up heading in this direction. And those, I mean, that just looks like you're gonna just die. And so you wanna know why Grandma and Grandpa can't move so well, is because their spines look like that, because they didn't get up. Not all grandmas and grandpas, and we know that. We love those grandmas and grandpas that are active and vital and move all the time, and that's why, right? Because we know that they are very engaged and they get up. They don't allow their bodies to be sedentary and compressed and damaging the spine. So don't be a smoker, don't be a sitter. Get up, move, get a standing desk. That's a very common, popular thing these days for this very reason, is they want to avoid this. So get on up and have a great day.